Hello, my name's Charlie Turner. I'm a National Strategic Accounts Manager for Dentsply Sirona. I'm joined today by Dr. Gardee, Dr. Balaji and Dr. Sisodia. So handing over to Jamil, if you'd like to introduce yourself, give a bit more info.
Hi everybody, my name's Jamil. I'm a dentist based out in Glasgow, Scotland. I've been practicing dentistry for over 20 years. Currently I'm president of the Digital Dentistry Society UK and an executive board member of the European Academy of Digital Dentistry.
Okay, Balaji.
Hi everyone, my name is Balaji. I practice in Buckinghamshire, and I do digital dentistry day-to-day practice, and I'm founder of ASHA Academy of Soft Tissue, Hard and Soft Tissue.
Hello, hi, I'm Nick Sisodia from South London. I have a practice limited to implant dentistry, but I'm a general dentist and do undertake some restorative work as well.
Fantastic, thank you very much. So the aim of today is to continue the conversation around implantology and full arch implantology in general. So just to get going with the first question, so to Dr. Jamil, looking at your current workflow for full arch immediate placement, could you elaborate on your patient journey a bit, please?
Of course. So I think the important things to understand from our practice is that we've never been a totally digital practice from the beginning.
Okay.
So it's taken us a little bit of time to get the workflows in place to enable us to have a seamless journey digitally. So it's taken a little bit of time to learn, and that's an important factor that I think everybody's practice is different, and so we've had to tailor it to the way that we've done it always in the past. So when we see patients, obviously we get them from two sources. One's referral, and then the others are just contacting us through Google or Facebook or ads in that particular manner. And it's really important to try and acquire the patients to do, because if you don't have the cases, then how can we do it? And I think digital has a big role to play in getting patients into our practice. So not just with respect to surgical guides and things like this, but with respect to other things like digital marketing and things like this to bring patients to actually do the cases that we want to do. And once we have the patients, really the first important thing for us is really to acquire the data. So we're really taking things like CBCTs, obviously, intraoral scans, x-rays, photo and video is a very big part of our practice, just to record the information from the patient and bring the data that they have in the physical world into the virtual world. And once we have that, then we can use various softwares to manipulate it. And we've trialed and errored a whole load of different types of softwares. I've been very fortunate to work with Christian Coachman and the Digital Smile Design team. So a lot of the guesswork has been taken out of it. And they've had, for a long time now, over 7 or 8 years, some validated workflows, all the way from single tooth dentistry digitally, all the way to full arch dentistry that we've been able to learn and benefit from. So as soon as we have the information of the patients, then we can start planning where the implants are. And we take a little bit of time to plan them. I know a lot of dentists like to do this themselves, and yes, we do that. But when you have a lot of flow from patient inflow, lots of cases going on, sometimes that's a little bit difficult to do. So we sometimes outsource that to the Digital Smile Design Planning Center. And then from there, once we have the plans in place, then we can execute it.
Okay, so yeah, what kind of challenges do you face with full arch, and how do you find that digital's kind of help you overcome them?
Well, there's lots of challenges, like I said, from the beginning on acquiring patients.
Yeah.
All the way to the execution of it. So we know that in traditional dentistry there are certain points which are difficult for dentists to do. As I said, from acquiring the patients, from getting the information of the patients traditionally with impressions, and is that accurate enough, the type of materials that we take the impressions with. So there's lots of bugbears or points that are difficult in traditional dentistry. And I think digital just makes it a lot more easier, efficient, predictable, and accurate. So, the fact that patients hate impressions, I mean, the three things patients hate that we find out in dentistry is one of them is taking impressions. Getting the local anesthetic, the sound of the drill, the other ones. So if taking impressions is a big thing that keeps patients away, just the intraoral scan and managing to be able to do that makes a big difference. I don't know what you guys think about that.
I agree. For me, the simple way analogy I use for digital dentistry is, I've been in implant dentistry before digital dentistry came on. So what I say to a patient or my colleagues is, we have been driving car for years without sat nav.
Yeah.
We still reach where we wanted to, maybe in 5 hours of time. But now with the sat nav, we'll be there in an hour. So we cut down the time in journey by something simple, thing like that. So digital dentistry, that's why I compare to my day-to-day practice. When I did implants before digital dentistry, I reached the result, but most of the time I said, that's not the result I was hoping for.
Yeah.
Even though exactly, the patient was like, oh, happy, but for as a clinician, I said, no, I planned my tooth should be there, but the screw hole should be here. But most of the time, it's just buccally or something other. Now with the digital dentistry, I know where I'm going to go. It's exactly like sat nav. I plan the case with this digital dentistry. I agree with Jamil, which is learning curve is quite difficult with digital dentistry. When you've been in my age of the implant dentistry, you just put implants wherever you wanted to with a OPG or something like that. Now you got a scan, intraoral scanner. So much to learn to start with. But once you learn, the predictability is so good, and patient loves them because they know they're seeing the result before the treatment starts, and then they're getting exactly what they've seen before.
Yep.
So it's a win and win for both patients and us, isn't it? And
I really think that's a fantastic point that you mentioned, because as dentists, we're really fixated on where does the implant get placed,
Exactly.
what type of abutment are we going to be putting on,
Exactly.
all these technical things. But really, at the end of the day, the patient's going to be looking at the teeth and saying, does this look like me? Is this great?
Yeah.
And if we don't take cognizance of this fact at the beginning and plan with the end in mind,
That's right.
digital allows us to do this, then we're going to have problems if we don't do that.
Yes, that's right.
I mean, coming back to the question that you asked, Charlie, as well, about analog versus digital impressions, and what Jamil said, there are occasions where we'll take both for a variety of reasons. And if you then actually take the trouble, and as dentists sometimes we're actually guilty of not asking patients things about their preferences for things. If you ask them which they prefer, digital versus taking an old school impression, they will tell you 9 times out of 10 they prefer the digital. But it also gets something else. They start to engage with the process far earlier. They see it on the screen, they're captivated by what's going on.
Yeah.
I don't know if you guys find the same. They start to point at things, identify things from a very early stage in the process. Whereas if you take a traditional impression, that goes off to a laboratory, the patient doesn't see it for a few weeks, and then you're showing them some model they can't really relate to. So there's a very different level of engagement from our patients when we do digital work.
And then the one thing, it makes you look clever in front of the patient, because when you do the digital dentistry, they look, wow, it's clever stuff.
But don't you think this is what they expect, right?
Exactly.
I mean, when I flew up yesterday on the flight, everything's now digital, right? So you order your food or in the plane on the digital, you access the internet or digital. So patients are exposed to this in their day-to-day lives. But then when they come to the dental surgery, now it's back into the dark ages. So this is super important thing, that engaging with the dentist through digital is fantastic.
Or even, as you touched on earlier, in terms of acquiring patients, before you got on the plane, your actual check-in was on your phone, right? It started as a digital engagement far before you got onto the plane.
Yeah. So it certainly adds a lot of value in that side of things with patient communication and buy-in for treatment plans. Yeah,
Definitely.
absolutely agree. So kind of going back to Balaji's comment really on guided surgery, where does that kind of fit with your workflow, and do you feel it enhances treatments in general in those full arch treatments? Nick, I guess.
Yes, I mean, guided surgery, we have to remember when we're talking about full arch treatments, these are often mutilated mouths. And a lot of the patients that we treat are periodontally involved. So the teeth are mobile, they're migrating. So before we go into the guided surgery, in terms of comfort level, both for us as clinicians acquiring the information and making sure it's accurate with teeth that are moving, mobile, it's far easier to do it digitally than to take an old school impression. When you're then coming to do the surgery, a lot of your landmarks are gone, you've taken the teeth out, unless you're able to retain a few to help see to guide. Having some sort of surgical guide, whether it be for bone reduction or whether it be for placement, or both in many cases, makes things far more predictable. And as Jamil touched on earlier, if the planning has been done in the lab, because we as clinicians are busy treating patients, those implants need to be where the technicians require them to be in order to get the outcome to be predictable.
Sure. For me, it helps very well because we're talking about before, I do a lot of augmentation, bone and soft tissue augmentation. And when you have digital planning and you have a team, because when you have digital work, you have a team involved, like technicians and then digital planning technicians. Before, when like Nick touched on, we do a take impression, send the model, and the model doesn't relate to a technician they don't see the face, eyes, face and smile line. So when you take photographs and digital intraoral scanning and digital workflow, so the whole team knows who the patient is, how the patient looks, and what the smile line looks. So when they design something for us and they design the patient in mind, so when the work comes back and I know, okay, where my augmentation need to stop or what sort of augmentation I need to do, it's much helpful for me that way to do further clinical work and make a decision where the restoration we're going to fit.
Yeah. I think this point is super important. That going forward, it was, collective intelligence, taking the benefit of the whole dental community, was very difficult in the past. Because you'd have to pick up a phone, try and get a time to speak to the person that you're working with. Now through virtual medium, you have a whole load of people, from the technician to the implantologist to the restorative dentist, all putting their opinion on the same case. So less chances of mistake. And I think one of the important things is virtual treatment simulation. So, you can see before you've placed the implants, before you've done the grafting, all the important things to watch out for, to take cognizance of before you actually do the surgery. So make mistakes in before you actually do the surgery.
Yeah. The one point I would say is, when digital dentistry came in, as a clinician, we always think, oh, the technician not going to have any more job or anything like that. But it's not true. They are more involved in our treatment planning now since the digital dentistry came in than before. And then the technician colleagues are much, much more important. They help us a lot through what digital dentistry has done for us as a dental community for technician and different things. It's created us more easy to communicate with them. And that's how I feel. What do you feel?
So it's that collaboration and from a much earlier stage.
Yes.
Because you have the information before the patient's left the front door, it's in the laboratory with your technicians.
Yeah.
You're able to have that discussion with them often on the same day, using other digital platforms such as WhatsApp or whatever else you're going to use. Very, very quickly, you kind of know which way you're headed with things from the outset. And you're all looking at the same thing at the same time when we're looking at things digitally on the screen. And that makes that level of engagement with the laboratory partners much easier as well. Historically, you might have the models and you're talking to a technician on the phone, or vice versa, and they've got something on the bench and they're talking to you on the phone. You're trying to have to imagine what they're saying. And you're not always actually on the same page, whereas here, you can move a cursor around the screen and you're looking at the same thing. That collaboration is far, far easier and in real time.
It's also a really great point about the fact that being teamwork, there's always been this thing that if you're doing digital dentistry, the technician would become obsolete. This is so important because it really shows us the importance of the technician and actually takes it, I think, to another level.
Oh yeah, definitely, I agree.
Yeah, and the starting point's prosthetically driven as well, isn't it? So
That's
absolutely.
it kind of actually involves them more than the previous ways of doing things. So going on to the validated workflow, so there's not really a currently fully validated workflow for full arch prosthetic workflow. How do you think this will impact you and your patients when this becomes available? Balaji, I guess.
It's a game changer, I think. Particularly full arch at the moment, and I do struggle with the workflow what we got with there's no validated workflow between me and my colleagues. So if we have that will be a massive game changer for everyone, isn't it? Yeah.
I think the thing here has always been the skepticism, perhaps on the part of people who haven't engaged with digital workflows early on, as to the accuracy of these things. And I think in their minds, they've got the sort of scanners that we had 10, 15 years ago. Understood, perhaps margins could have been better on some of those restoration things, but things have evolved at such a rapid pace. I think that there's so much coming out in terms of publications now where the accuracy of what we can get digitally with the right scanners is going to be far more accurate than what we can do analog workflow, and that will mean that it doesn't make any sense to work in an analog way anymore.
Yeah, absolutely.
Yeah, the scanners as well, it's changing. And since I got the Prime scan recently, 2-3 years now, it's a game changer for me, for my practice. Yeah.
You know, it takes a bit of time for information to filter through, right? So especially with the digital world, because things are always improving, you're getting new versions of software being updated. So it's very difficult to put things into paper, because as soon as you put it into paper, something else has now changed in the digital world, right? So, you know, the other important thing to bear in mind is that there's more than one way to skin a cat, and people have different ways of placing implants, different methods that they use just depending on the situation. So all of these particular methodologies has to be transferred into the digital world, and that takes a little bit of time. But I mean, there have been publications already. Journal of Prosthetic Dentistry in 2016, Christian Coachman and Masila Kalamita produced a full arch digitally guided papers. So there's these peer-reviewed journals out there that have workflows available. Yeah. It's just a matter of trying to find them.
Okay.
And I think, you know, when you're talking about validation, I think it's often from a company perspective. Okay, yeah. We as clinicians, what we want to know is, do things fit? Are they accurate? And early days when we were doing these workflows ourselves, we would actually often get multiple things milled or printed just to check the accuracy and make sure that things were fitting and that they were passive. So for us, in our clinic, we're certainly very happy and comfortable with what we're doing at the moment, whether it be full arch using zirconium beams or titanium bars. We are comfortable that they fit as well, if not better usually, than traditional workflows.
Yeah, there's been a big shift towards zirconium recently, hasn't there, for full arch, so I guess that kind of ties in quite nicely with being able to link it all seamlessly as well.
That's right.
So,
And there's a reproducibility with these things. If things break or fail, it's a matter of pressing print or mill, as opposed to a human being having to actually fabricate something from scratch. The number of man hours, and as clinicians, we often sometimes forget that there's a shortage of technicians out there in the UK. And having a digital workflow and a digital team means that you're able to actually have a greater productivity from your lab. Because, you know, there's a machine milling or printing things. There's a human being designing it, approving it, but the actual labor it's not so labor intensive. And it's important. I don't know about you guys, but the lab turnarounds are getting longer and longer. They're busier and busier, and there are fewer technicians able to produce this work.
Yeah, like the reproducibility, you're right, because you know, once you have a digital data stored somewhere, you know, you just need to have a phone call or even text message. Can I have that done? Done in a couple of few days. Before you got to take re-impression, analog impression, and all those things. But that's a very good point. Yeah.
And I think it's just a matter of retraining, isn't it? I think there's a lot of technicians out there that have been used to traditional workflows, and it's just taking them a bit of time to move over to digital. Because hopefully the end result is that if we've got things being done digitally, then it should cut a lot of the excess time that they took to wax up, to invest, to fire in the oven. You know, these things don't need to be done anymore. You know, you can, as you said, we can mill things, we can print things a lot more easier. But it's trying to now, you know, get the technician's skill to a level and the dentist's skill to a level where they're utilizing digital technology, and that takes a bit of time. So, you know, just going back to the issue of implementing these workflows or implementing these things, was it easy for you to, this is a genuine question, was it easy for you guys to actually implement?
No.
Or were there trial and error? I mean, for me, there was a lot of trial and error at the beginning.
Absolutely, and you know, in our practice, we ended up where there are two clinicians, myself and Martin Wanandea. We took the decision that one of us was going to be the person that actually started adopting this and making the errors early on and learning from it and passing the information on to the other, because what you don't want is two people producing volumes of work with lots and lots and lots of errors. So we're constantly learning. Even now there are errors and we're evolving, but early days it was hard.
To be honest, I hated it. When digital dentistry came, I said, no, you know, I'm not doing it. That was one of me, like, but now I love it. You know, it took a long time.
And this is so important, isn't it? Because I think this is a familiar journey to everybody.
Exactly.
At the beginning, because it's different, it's new, there's a natural antagonism towards it.
Yeah.
And you have to get out of your comfort zone to be able to do it. But the key thing that we found is that when you persevere, you will never go back.
Oh, definitely not.
Right? And this is the really important thing. So it's really a practice changer. it's a personal, as on a personal level, gives you a new leaf of life in dentistry.
Yeah.
And it's just, to me anyway, it's a better, efficient, easier way of practicing dentistry, more elegant way of practicing dentistry.
So not only that, the nursing colleagues, they love them because they don't have anything to clean these things, but clean the alternate bowl or a silicone and clean the chairs and tables and stuff. It's just very, very easy, and they love them because you know what, it's easy for them, and it makes everybody's life easy. Patients love them, and yeah, it makes you look smarter. So
I think you only realize how much you rely on this technology once you become an adopter and you start implementing it as a protocol rather than just an ad hoc thing you do once in a while.
Yeah.
When the machine is out of commission for servicing, or it needs something and it's not there, you suddenly realize that you're not looking forward to seeing that patient so much because you're having to work the old way.
That's right. That's right.
And it's a bigger trudge for you to get through that workflow in the old ways that we used to use with analog impressions and techniques. So we've had the odd occasion where we've had to have the cable on our scanner replaced. Scanner's not working for that reason, and you have 2 or 3 days where you don't have the scanner. You're suddenly working in a different way that you're not comfortable with any longer.
Yeah.
And coming back to your point about the team, it also makes our workflows internally far more efficient. We run now a couple of days a week scan clinics.
Yeah.
So you're able to delegate these tasks to your team, and it engages your team better. They enjoy it. The patients are happy to come in, quickly see the nurse, take the scan, and you're freed up to do other things.
That's right.
And what Jamil was saying earlier, I mean, I think geography gets taken out of the equation. You mentioned Christian Coachman. You can have a global team now. Your
Absolutely.
person designing the teeth could be sitting in Paraguay, you're in London, or in Glasgow, or in Buckinghamshire, and somebody else actually pressing print could be sitting somewhere in Belgium or another part of the world. And it's a truly global team, which wasn't so easy when you had to physically send things to people.
Yeah, it benefits patients so much because of the expertise from all over the world coming to work to produce a result for the patient. It's amazing. Before it used to be just you make a decision, you design, you do everything. We are not expert in everything. You never be able to expert in every single field of dentistry. So now we use the different expertise in different part of the world, and that delivers to the patient. Fantastic.
Yeah, so you guys don't do everything yourself, right?
No,
I certainly don't do everything myself. There was a time at the beginning where I wanted to do everything to learn it, but sometimes I think as dentists we're guilty of trying to do too much.
Yeah.
Control freaks.
Yeah, exactly.
Absolutely.
You're not a dentist if you're not a control freak.
But you have to learn to delegate, and digital dentistry allows you to do that. Digital technology certainly allows you to do that and broaden your team.
Okay, brilliant. So my final question would be, what's been the most important advancement in this kind of digital side of dentistry for you in your journey?
So I think for me, it's the intraoral scanner.
Okay.
I mean, this has been a game changer for our practice. All the issues that I had, and mostly I'm a prosthetic dentist, so or restorative dentist, so I do a lot of the restorations in our clinic. Dr. Harun Sher, who's my partner, places most of the implants, although I do it occasionally. He's an amazing dentist. But the ability to copy and paste dentistry, be able to copy things and give the patient exactly what you promised them at the beginning is incredible. To be able to record the information at the first visit without having to put alginate in their mouth or messy impression materials in their mouth, and the way that as our panelists have said, the way that the patients interact with it, these are game-changing things because they tell their friends, they tell their families. So many people are getting referred to us just by that this is a different way of practicing dentistry. It's nothing that we've seen before. That it's a real great practice builder for us. So for me, the intraoral scanner has been critical. And you're right, sometimes occasionally things go down, not for very long, but things go down. And when that happens, I'm panic stations. Cold sweat that I have to go and take an impression again. So intraoral scanner for me.
Okay. Same as Jamil, intraoral scanner and then the whole thing, because I do teach and I do travel a lot. I can be in any part of the world and then open my computer and start planning the patient's cases. Yeah. With analog, we couldn't do it. So, and I can communicate with my lab and my team from wherever I am. And so that allows me, the digital dentistry allows me to plan the case wherever I'm, whichever part of the world I'm in, and communication with different part of the team. That includes patients as well. That made easier the intraoral scanner and the diagnostic thing through the intraoral scanner and then the scan and everything communication. I can email to the patient, look, this is what we are looking for, rather than having a wax-up model in the hand, post it to them, and halfway through it breaks into pieces. So communication with the patient, easy for my life and my team to work. That's the game changer for me.
For me and our team, I think it's the ability to use that intraoral scanner to get very accurate information right at the outset and marry that up with a CBCT. You now have a virtual patient. We're getting to the point, we don't have this yet, but I'm looking forward to it because it will revolutionize what we all do. The ability to actually articulate these things in 3 dimensions, and you really truly have a 3D patient as a virtual patient for the whole team to look at, and wherever they are in the world as part of your team. But for us, the intraoral scanner married up with a CBCT.
Yeah. Okay. Well, thank you very much to all of you today, and thank you for joining Let's Talk Live Decoding Digital Dentistry. If you'd like to carry on the conversation, then please head over to the networking rooms. Thank you very much.
Thank you. Thank you.